Recovering from Stapes surgery? Here's what you need to do to ensure a smooth healing process and the best hearing improvement. Take it easy for the first few days and avoid strenuous activities. Sleep with your operated ear facing upward to minimize pressure. Mild dizziness and nausea are normal. Use prescribed medication if needed. Keep your ear dry for at least 3 to 4 weeks. Use a cotton ball with petroleum jelly during showers. Avoid blowing your nose forcefully. If you need to, do it gently with both nostrils open. If you sneeze or cough, do so with your mouth open to prevent pressure changes in your ear. No heavy lifting or straining for 4 to 6 weeks to protect the prosthesis. Move carefully to avoid sudden head movements that might cause dizziness. Avoid air travel, scuba diving, or high-altitude areas for at least 4 to 6 weeks. Take prescribed antibiotics and painkillers as directed. Avoid NSAIDs like ibuprofen, as they can increase the risk of bleeding. Your hearing may fluctuate, and full recovery can take 6 to 8 weeks. Ear fullness or mild tinnitus is normal and should improve over time. Attend all follow-up appointments for dressing changes and hearing tests. Contact your doctor immediately if you experience severe dizziness, worsening hearing, persistent discharge, or facial weakness. Following these guidelines will help ensure the best possible recovery and hearing improvement. Take care, and don't hesitate to reach out to your doctor if you have concerns.